discuss a very important and a compassionate topic, that is relaxing and calming strategies for children with special needs and autism. Now, understanding autism goes beyond definitions. It's about learning how we, as parents, as caregivers, or educators, even health professionals, can create a supportive as well as an empathetic environment for these children. Today, we aim at exploring the practical strategies that we can utilize on a day to day basis to soothe, connect, and effectively communicate with children. And also, it is equally important to understand that it's a very important role of the broader community in fostering inclusivity of these kids and also parents and the families of these children. Okay, so let's try to understand. Before we begin, I would like to give you a brief introduction about our speaker. Uh, we have today with us Aisha Firdos. Now, if I want to talk about Aisha, I know her from quite a few years now. I know her from when she was a mother, just a new mother, and to now when she's a confident and certified autism specialist. Now, her journey began not in a classroom but in the heart of a mother. When when her son was diagnosed with autism. She never heard of the word autism before. So, like many of us, she turned to Google and YouTube in search of answers. But the true understanding came through her hands on experience and also parent training. Uh, that powerful journey inspired her to pursue a master's in psychology, build a meaningful career as a special educator, mental health expert, and clinical psychologist. Now, over the past 7 years, she has dedicated her life continuously to learning and supporting families. And since 2023, mashallah, she is a certified autism specialist licensed by IBCCES USA. She has also written over 13 insightful articles on neurodevelopmental disorders in the Giving Now magazine. And it's a very proud moment for us because she has also been honored as a successful person for development and transition of persons with disabilities by the Giving Now magazine Bangladesh. She is also the head of Karnataka in Green Pencil Foundation, and apart from that she also runs she's a co-founder of a Facebook group, okay, which is named as Differently Abled Journey. Now this is a group where parents and professionals will connect and share their experiences and thoughts and their insights about how to deal with children with special needs. It's indeed a pleasure to welcome you, Aisha, and please join me in welcoming this inspiring mother and change maker. Over to you, Aisha.
Good morning, everyone. Thank you for being here, and thank you, Dr. Ghazala. She is a family friend. I've known her, and it was not a coincidence or something, but she knows every step how it started with diagnosis and how it's still now and beyond. She's been there for me, like whenever I've gone and discussed about my certifications, about what I am doing, about my child and all that. He's like, okay, on your, it's inspiring. And I was like, yes, somebody is there. And thank you for warm reaction and for giving me this opportunity to engage with everyone present here. And I look forward for a meaningful interaction and valuable exchange of insights over here. So thank you for being here, and thank you, Dr. Ghazala. I can't thank enough. I am just exploring. I'm still learning, relearning, and again, I'm just trying to do something new every day. I want to learn something new every day. So that's how it is.
Pleasure,
So
pleasure.
moving ahead. Mm, I'd like to share my screen here. Dr. Ghazala, is my screen visible?
Yes, yes, it is.
Is my screen visible?
Yes,
Yes, yes, it is visible. Yes.
yes, it
Yeah.
is.
Okay. Okay. So I'll straightway come to a point where what is autism? Where most of us, as common professionals, doctors, because they've just heard the word what is autism, and common parents may have heard or may not have heard what is autism. Autism is unlike any other disabilities. Like you can see cerebral palsy, individuals being on wheelchairs, and you have seen them in some different physical features where they have a big head or their hands are not in proper physique or in structure, and you feel like, or you can identify, oh, they are not common, or they're not in general, or they have some kind of disability. That is how you identify them. But in case of autism, it is a total different thing, where they look very normal. Okay, even if you explain, people sometimes they'll, I don't see he is a little different, there's nothing, he's fine, he's normal. That's the common phrase you get when you even see an autism person as a common parent or as a common doctor. Sometimes even doctors are unaware they have autism because they look normal, unless and until you spend around 10 to 15 or 20 minutes, or you observe the child for 20 minutes, that something is different, you won't be able to identify the disability in an autism spectrum disorder individual with autism, or any other disability like learning disability. The famous thing what you can identify or imagine is Tare Zameen Par, which is a very very common movie which is seen to just understand that the kids are very normal, but inside what's happening, how are the learning difficulties they are having, how they are facing things, what are the challenges, they're unable to concentrate. So all those things are very advancedly explained in the movie. Similarly, there are many other movies which are present, we will be discussing, or we can give just an insight later on after the webinar. So right now what I want you all to focus is autism spectrum disorder. Since it's a spectrum, it's one autistic person, one feature or one thing in an autistic person will not be similar to the other. So it's a spectrum. Just as the spectrum of the light has different shades, the autism spectrum disorder have different kinds of frequencies of symptoms. Even if you take one symptom, the frequency may be different, the pattern may be different. So that's the reason it's called as a spectrum. The word autism is a spectrum. And when you have a spectrum, it's like an umbrella where you have Asperger's syndrome, you have PDD, which is called as pervasive developmental disorder, you have autism disorder as such, and you have something called as ODD. So it's a very advanced terminologies which are used, which I don't want to go in detail. It's just for the general information. So right now, 1 in 45 children age group of 8 years are being diagnosed as autistic. The reason is genetic. The reason is another thing is our food intake, our diet, which plays a very important role. Other reason is the depression, which is gonna happen during the prenatal phase or during the pregnancies. You never know how the mental status of the mother is. Even till now, till this date, nobody is able to give you specific reason or cause of autism. So still it is in progress. Some say it is because of the vaccines, which is still a question mark. There is a lot of research which is being done, and there are a lot of treatments and assurance that it can be curable. I want to tell you all this, that autism spectrum disorder is uncurable. Even if they are giving you assurance, it's a false assurance what they have given. I have gone in depth with it, and I can assure it because I have seen all the research papers. Whatever they are doing with autism spectrum disorder, there is a theory of stem cell theory where they are giving me, I told them to write and give it to me, they gave me 80%, no, 20% of assurance. With that, you can't risk a child's cells which are very unique. They are gifted, they are talented, you never know what kind of talent they have. So it's a blessing, I can tell, that we are special because they are talented in their own way. And moving ahead with that, you have autism, which in common terms, instead of these terminologies which are used, that is common or communication problem issues. When you go and communicate to them, they will be like, they'll be in pause phase, they don't interact with you, they will be in that like, okay, this is how it is, and they don't respond to you whatever you do. Whatever you do, you go, you say hi, you give a shake hand, nothing. They just move away, kind of. The other thing is social communication. Again, usually, normally, kids, when you interact, say hi, hello, they respond hello, hi, give a smile at least, give a eye contact. That social interaction of eye contact, or that smile itself is absent. And then you have repetitive behaviors. You often see them clapping hands, having a toy with wheels which they keep on rotating, or they themselves keep rotating. Something unique or something different, which is, repeatedly they do. So that behavior gives you an idea that, okay, this person is autistic. Again, there are sensory issues where they roll on the floors. They don't want to get up wherever they are. On You can see this in malls. You can see this wherever you're interacting with the pediatrician. They try to roll on floors and give tantrums. They cry, and they like to sleep down on the floor and look at the sky and just keep staring. Those kind of behaviors or sensory issues, like they want something in their hand, they want noise. Those are sensory issues or processes which are very commonly seen. Delay in development, for example, sitting, right from all the developmental milestones, what you can observe. It's not that every developmental delay is autism. No, there are a lot of things which you need to assess. It may be like, suppose a child is able to walk around 1 or 2 years. This child may be later on the end for about more than 6 months of delay. So that is declared as a delay, not 2 or 3 months here and there. But yes, a prolonged delay is labeled as a delay. Apart from that, you can see the spectrum which I mentioned here. It's a spectrum where all are not alike. Some are highly function, some are low function, some are harmful, some are not harmful. So you can't declare a person with autism as a harmful person, nor can you declare that he is a very silent person. It's always that they are unique. That is one thing which I would like to stress, that they are unique in their own way, and they are different. Now, when it comes to what you should not do, before what you do, I think you have to understand what you should not do as a precaution. For example, you are given, and you buy a new electronic item or some machine. You have to see what you should not do in order to save it. Similarly, I want you to understand what you should not do if you see a child with autism. First and foremost, do not stare or make judgmental faces. For example, it can be very, unsettling for both the child and their caregiver. The moment we see something different, we'll be like, yes, we keep on staring. From now onwards, if possible, try to reduce that staring for maybe a few seconds and just move out. Then don't assume a child is misbehaving. Often we have these judgments. What kind of parent is this? They are not, observing the child. They are not, telling the child to keep quiet. What may seem like a tantrum could be a sensory overload. And the parent or the caregiver of that special need is aware of it. And we are very vigilant in telling the statements of what kind of parent is this. So next time when you are seeing any child misbehaving, try to observe the parent, how calm the parent is. Try not to give advice unless asked. Every individual is different, and parents are often already doing their best. You see, as soon as you see something different, they will be like, you try to do this. There are thousands of advices that come in, but they have already gone through that. The parents of special needs have already gone through that, and they are doing their best. Okay, so don't ask or don't speak about the child in front of them as they aren't there. It is a little hurtful, because even though they can't respond, they are able to understand in their own way. It's like, whatever you're telling, he's not understanding. What's the use? How will he understand? We can talk, it's okay. No, it's not okay. They are able to sensitize this. Like, even if they are staying in one specific room, if they have three rooms ahead of them, what's happening in that three rooms, they are able to sense that. Their senses are so advanced, that They can sense the smell which is being cooked, what is being cooked. They can easily come and see if the kitchen is very far away as well. No issues. They are able to, take their caregivers towards the kitchen where it's been cooked and what they like, and they are able to specify through their gestures they want to eat it. So they are very sharp in their senses. So before you speak about them, please don't tell something which can be hurtful. If the child is able to understand or not understand, they are able to sense it by the way you have your facial expressions. So be careful when you're speaking about the it's even for the common parents who don't have special needs. It's a good thing not to tell anything negative about a child according to the child psychology. That if you are telling something bad about the child, that means you are demotivating somewhere down the line. So it's better that we don't speak something negative about the child in front of others. Apart from that, avoid forcing eye contact or touch. Suppose the child of special need is not, mingling with you or not interacting with you. Don't force. Come on, look at me. It's a curiosity of a common parent. No, I can do it. I have to do it. No, sometimes that's their characteristic, that they don't have eye contact. They don't want to be touched. That's their sensory issue. So instead of forcing them, you just allow them to be comfortable in their own zone. So don't reduce the child to their diagnosis. See something like, see them as a human first. Like, don't categorize them or don't give them that special kind of treatment also. That also affects the caregivers. That sympathy, it's always not that they need sympathy. No, they don't need that sympathy. Just treat them normal. It's fine with them, because these things are given by people who are already, they are autistic, and when they started expressing themselves through blogs or any other YouTube channels, when they started understanding and started expressing, started writing books, this was something that they told. Like, often we used to get that sympathy as soon as they see us. We don't need it. Okay, that was something which even I felt as a mother, that sometimes, yes, let them be the way they are. uh, and the next one is refrain from comparing them to with other children. It's unfair and unhelpful. It's not helpful for them in any way. Even if you're comparing, it's not helpful. It's not going to make any difference if you compare. So often I have three kids with me. I had a lot of comparison initially when I used to, it's very common to compare. Yes, within the siblings, within the cousins, within the classmates, it was happening. But at some point of time, if you, as a leader of the team, as a professional, as a doctor, as a common parent, as you tell your other uh, you know uh, children also not to compare them, it would be a wonderful thing what you would do. Don't expect instant responses. For example, you tell something and you ask them, what is your name? You want an immediate response. Come on, tell me. Come on, tell me. You give so much of pressure. Okay, within that one 30 seconds or 45 seconds of time, you ask them around 10 times, come on, come on, come on. It gives them a lot of stimulation, overstimulation for their processing time, and they may just understand the word come on, come on, come on. It may not be what is your name, only the name. They will catch only specific things like, come on, name, 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 come on. They are unable to process your question. So when you are dealing with any special needs, give them that processing time. Be very specific, be very firm in your words, that what is your name. Try to make them understand. Slow down your process, slow down your words, slow down your ability to get back that, give them a pause of 1 minute. If they are giving you an interactive look like, I want you to repeat, you can sense that only after you are dealing with these kind of kids. Often it's like we just need a response, so we keep on asking. It's not like that. You allow them to process it and see how it works. Often this is the biggest mistake, I think, what people do is they want an immediate response. So give them that processing time, take a pause phase, allow them to process things. Like, this is similar to the response to the stimulus, you just touch off it, and your finger, you will take back your hand. So it's a fractions of seconds. But in case of special needs, it doesn't happen initially. They don't even remove. They're unaware of the harm that it's been caused. Their stimulus is not given to the brain, and the brain will never send back the response immediately. It takes a long time, maybe 2 minutes. After 2 minutes, they'll start looking at their hand, and they feel like, oh, something is wrong. So even in order to understand your question, the processing time is required. Don't talk to them in a loud or exaggerated way. It's often something which triggers as professionals, as parents as well. Even I lose my calm sometimes. It's very common, but yes, we need to have a very calm tone, unless and until you know that the child only listens to you when you are firm. Please don't try to do the firm tone initially. Go ahead with a very calm, friendly, have a rapport and all that stuff, and then you can start with your. Usually, I see therapies in where like therapist centers. Therapies are going on in a very vigilant or very aggressive way. Like they treat you, they are treated like animals. I can tell you very clearly. Special needs kids are treated like animals. They are places, but it's just to look at them, it's like animals. It's the theories what they have been applied. It's the other way around. After the therapies, you see the therapist and the child or the special needs. It's totally opposite. They are the most loving therapist you can see. Initially, when I went on and I just saw out from the outer end, I was like, why is my son treated like an animal? But then I got to know that it is the way, it is the strategy, it is the therapy, it is the theory behind it. And after that, it was like whatever they tell, my son is able to do it. It's like that. It's not always, but yes. But XYZ person seeing from outside, they will never understand it. If it is a certified therapist, if it is a person who is dealing with special needs in an firm way, please don't judge them. That is also one of my points in these sessions. Apart from that, there is never ignore the caregivers. They play a very key important role. They need support too. When there is a caregiver, when there is a parent, we often tell that child we feel all other things for the child, but what about the parent who or the caregiver who is going through all those things for 24 bar 7? There is always that stress which is happening. There is always that question mark, what next? There is always that proactiveness to be on the toes, to be ready that anything can happen anytime. Any behavior can happen anytime. So these are some things which you need to keep in mind whenever you see a special need. I know all these points will not, you will not be able to you will be in your own position, you will be handling so many cases and all that stuff. Yes, in order for you to remember, I would request you to take a printout of it or stick it somewhere near your workplace. Now you know the next patient is a special need, just go through it once. Tell your subconscious mind that this I need to keep in mind, and then you proceed and see the wonders. That is something which even I practiced initially, and I am moving on with the same thing for the professionals who are working here. I request you all to have something, some strategy for special needs, what you can do based on your profession. Stick it on the wall. I know it's it looks a little maybe awkward or something, but still, if it's there, it's good for you. It's like a note for you. Okay, special needs is coming. I'll just have to go through this. Prepare your mind, prepare yourself, your mindset, and then you do. It works. It's very the work whatever you will be proceeding will be effective. That's what I can tell from my end. So this is something I think Miss Dr. Ghazala will can also share it with you. The next is the sensory. This is the most important thing which you need to keep, and this is the calming strategies where we will move on. So when we are moving with head, many children with autism process sensory information differently. Some may seek out sensory input while others may try to avoid it. Here are a few helpful tools. For example, deep pressure. You can see a whole lot of things or tools or toys according to you, but it plays a very important role in lives of special needs. Deep pressure using weighted blankets or firm hug. You don't have anything with you. A firm hug you give them. Only if the child is comfortable. It can calm them. Usually they go to the mothers or the caregivers for this, and they are provided with it. Next, fidget toys. I have seen this with all of them who are stressful, they use it. Items like stress balls, chewable jewelry can help them focus and reduce anxiety. Lighting, dim or colored lights can soothe a child who is sensitive to bright environments. A simple lava lamp or galaxy projectors can also do wonders. Sound, some children, they respond to white noises like very calming music. Even in your clinics, if you are adding on when there is a special need, a very calm and relaxed music, maybe the child will settle down all his other behaviors. Others may benefit with noise cancelling headphones. You can have a handy headphones to avoid that irritating or the other sounds which are annoying the child or having more sensory things. Apart from that, you have deep breathing. So, relaxation is something that can be taught and practiced at an early age. For example, deep breathing. Simple breathing examples like you can pretend to blow up a balloon or blowing bubbles can also help, and it will be like a fun and engaging thing. So, you want the child to relax during your therapies, during your sessions, during your interactions. You can do it like a play. The play is the best way the child can interact with you. Progressive muscle relaxation. Try encouraging a child to, squeeze like a lemon and relax like a jelly kind of thing. Something which is, pressurizing all their muscles and making them concentrate in what they are doing. Grounding techniques, most of the time I've seen Dr. Ghazala doing it. Uh, Very common one or very popular one, which works wonders for any kind of kid, even for the common kids. 5, 3, 2, 1 activity. Name five. And in case of special needs, you can have a small book or something where you can give them five things that they can see, four things that they can feel, three things that they can hear, and so on. It keeps them, engaged in those activities, and they'll forget what they have come for. They will be relaxed. It will be like whatever you do here on will be like a play for them, and they'll be comfortable. The main idea about all these things is to make the child with special needs comfortable, relaxed, and happy during your sessions or during your therapies or during your procedures. The next is sometimes small changes in this environment make a very big difference in case of special needs. I have seen a very attractive one for me was Dr. Ghazala's clinic where she had this roof for a cloudy thing, which I myself as a common individual was lost for a few minutes. It is very relaxing. It keeps your mind out of the world. So set up a calm environment as simple as beanbag, soft lighting, sensory toys. Then reduce the stimulation by removing the clutters, like for example, turning down the harsh lighting, using calming colors, and even a classroom or a playroom, small room or a corner that can be adjustable with more soothing things, so that after you're done something, they want to get out of it, or they want to have that 5 minutes break, they can go there, see something, and come back. Then you will be like, okay, you do this, then you'll get back this kind of things. So environment plays a very important role for special needs. Then you have something called as this or that. You can see the visual schedule, which these are called as visual schedules or visual aids in special needs. If they are going for therapies, they will have all these handy. This is first, the doctor will see you, and then you will get your favorite toy. And then you have going to a dentist. Why I've taken dentist? Because since Dr. Ghazala is a dentist, I thought I'll do it in this way. It would be better. So there are a lot of points which has been discussed. Talk to the receptionist. So each and every step is important when you're dealing with special needs. Talk to the receptionist. Sitting and waiting is also a point or a target that is very difficult for special needs. Go to the dentistry room. They have to see that chair Otherwise it's like they have gone somewhere else. They should understand and have this notion of, okay, this is how it looks before going to any place. So sit in that chair, and then you have to open your mouth, say ah. You have to see, they'll put something inside your mouth. You have to rinse your mouth. You have to say goodbye. Then you'll come back to home. So this is the procedure, or it's very important for them to understand this procedure before they are going to any appointment. Suppose it's a common pediatrician, what they'll be doing. So you have to prepare something like this. So something, suppose we are going for a vacation now, since the vacation time, we tell our kids, right, something exciting is going to happen. We'll be doing all these kind of activities. It's the same way. It's nothing special. Just the difference is it's a visual thing, what's being told, or something like a cartoon kind, or they, for them to understand in their own specific way. Some are even okay with the YouTube videos where you'll get to know what is the procedure or how they are going. Even that is fine, but others who are not so good with the videos, YouTube videos, they are okay with the visual schedules. For them, these pictures play a very important role. This is the pattern how they learn. So this is most common in autism spectrum disorder. Wherever you see an autism child, you'll have this visual aids. So that is why I have just updated this here. Then you'll have regulating through movements. See, when it comes to movements is a very powerful self regulation tool. Even in a common man, you are, exhausted, you are stressed, you have back to back patients. You need to take a pause. Somewhere down the line, you have to take a pause. Get out of your seat, get out of your place, take a walk around, take some sip of water, change your movements, and then you come back. Within that 1 minute of time or 2 minutes of time, you will release your stress like anything. But if you're sitting in your cabin in that same environment, in that same place, and you're drinking water and you're not moving around, it's not gonna work. You have to have that movement for your self regulation. You have to get from your place, you have to change your environment, you have to take a round somewhere else apart from your clinic. Go down, go down somewhere for 1 minute or 2 minutes, then come back and see the difference. So that's a tip from my end as a mental health expert, what I can give you. Heavy work activities like pushing cart, carrying books, animal walks can help the children feel more grounded. They can't focus for a long time. They can't be with you as a patient for a long time. During the dentistry processes, you have, like, they'll have to sit for a few times and a few minutes, few sessions. I've seen Dr. Ghazala playing a very important role there. She'll be giving the break and, to relax, come back, relax. I don't know, she's aware of it or what, I have no idea, but it is very, 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 very important to give that pause of 1 minute or 2 minutes. It needs a lot of patience, but yes, it is very effective. It is very effective. When it comes to rhythmic movements like rocking a chair, swinging, and then gentle bouncing, and then can be incredibly like calming. You don't have all these things in your area or of working. So what you could do is you can hold, you can make them turn around, you can do whatever you can. Bouncing, yes, you can sit and bounce, or you can just roll them, like swing them. Both parents can swing them. That is what me and my husband do. We don't have all these tools where we go, wherever we go. So we do whatever we can through our hands, through our gestures. We try to make them do these things. So it reduces everything else. Then you have this very important tool, which is and which has to be there in almost all the working areas or wherever the special needs is, stepping in. For example, helping the children understand and express their emotions. This is done throughout in their therapies, visual schedules to show what's happening next. This will also reduce the anxiety. The emotion thermometer is a great visual tool that helps the children identify how they feel and what they can do to calm down when they are overwhelmed. For example, you will do your procedures, then you'll ask them, where are you in this meter? You'll ask them, they will point out. They will definitely point out. They know what is the meaning of each emojis which is there. This can be done with the age group of uh, after 7 years. Before that, it's very confusing for them. They can just point out, randomly. But after 8 years, they are able to, identify their emotions and even express their emotions. So this is after 7 or 8 years. If you deal with special needs, then you must have, and you should ask before the treatment, how are you feeling now? After the treatment, how are you feeling now? So if it's a great, it's a plus point for you. So once you start doing it, it will be like a random thing which you will be doing on daily basis. So it is a very important tool for you to deal with special needs. Apart from that, you have mindful and mind body techniques where mindfulness does not have to be complicated. Use guided imaginary, like for example, imagine you're lying on a soft cloud. It's all about imagination. But this imagination technique can be followed on if and only if the child is aware of it. The child is able to comprehend what you're telling. The child is able to understand and give a response, thinking process, creativity. Those things come in only after they are 9 or 10 years. Before that, it's just that they are seeing something and they are responding. They are unable to understand, process, and respond to it in a understanding is not clear. They are not able to comprehend things. This is use this mindfulness can be followed only after 9 or 10 years, not before that. Visual schedules, wait in the lobby, sit. So these kind of, you'll get n number of visual schedules in Google. If you want, I can send it to Dr. Ghazala, where you can specifically for which clinic or which place you are. Even at homes, you have special needs. Yes, even for common parents, I suggest you to have this during summer vacations, which you already have. You prepare some these kind of charts where you want social skills to be developed by your kid. So you can just write down like a list like this and stick it somewhere in the wall, and you can give them stars if they are doing the work. You give them weekly targets, you give them day-to-day targets. At the end of the day, they'll receive some stars. Kind of target-oriented approach. So there are a lot of things which you can do instead of screen time. Then there is something called as triggers. Identifying the triggers. So when it comes to identifying the triggers, observe the behaviors. This is done only when you are dealing with the child 24 by 7. It is something which we do, not in common to all. But yes, if you have a child who has a lot of tantrums, who is very impulsive, who is who's very hyperactive. So for you, this is a very good where you will identify the triggers, observe the behavior patterns for stressors. For example, you have an behavior. Suppose a child screams. You should understand what is happening before he screams and what happens after he screams. What is your response? And if the behavior is there, you just can't tell he screams, he screams, he screams. No, you have to understand why and what next. Only then can you work on that behavior, and that can be reduced. Use on You have to use a preferred item or an activity, favorite toy. Suppose he's screaming, he'll get something. He'll get chocolate, he'll get his tab, he'll get his mobile, he'll get his toy. Grandparents will take him out. So those things are something, the consequence. He knows if he screams, he will get these things. So, in order to reduce that screaming, you have to avoid whatever is being given if he screams. Even if you're screaming, you're not going to get the tab, you're not going to get the TV remote, you're not going to go out, you're not going to have that chocolate. Then what next? His screaming is not working. So, he will stop his screaming. So, that is how you'll have to build that comfort and trust, not by providing things in order to reduce the behavior, but to give that behavior another U turn. So that takes a lot of patience and a lot of practice. Initially, it doesn't happen like a quick fix thing, but if you try, it will work. That is what I can say from my experience. Then the last thing what I would tell you all is from the therapist point of view, or the terminologies used in therapies and techniques used for these behaviors, whatever I've told you about, a small example of screaming, it's called as Positive reinforcement, that's defined as an adding a stimuli to an environment. For example, he is screaming, you will give whatever he likes, you will keep those things in front of him and he will stop screaming. That is called as positive reinforcement. Negative reinforcement, if he screams, you will keep all the things which he doesn't like, or you will take away all the things from him which he likes, and that will be removed. That is called as, if you are screaming, you are not going to get all these things, and you are going to show that and remove it. That is called as negative reinforcement. Reinforcement means it is the increase of the occurrence of the behavior as a result of either you can add or you can remove. For positive, you will give it only when the work is done. Like suppose you want the child to stop screaming, you will tell him, if you stop screaming, you will get this chocolate, like a common parent. And negative will be, if you don't stop screaming, you will not get this chocolate, and you will take it away. Then punishment is very common, which common parents do. No matter what you do, you'll not get it. This is your punishment. So this punishment was very common for us maybe as kids, but now it doesn't work. For this generation, Gen Z wala generation, punishment will not work. If you punish, you will also be punished. So that is the generation we are living in. So apart from that, key tips what I would like to give: prioritize sensory preferences and triggers. Check what is the sensation happening, why is it happening, try to understand. If you're not able to understand, communicate or ask the caregivers and the parents. They will be the best persons to tell you about it. Don't conclude by yourself. Use consistent and predictable routines. To follow the routine, suppose they have to come back after 7 days, you need to tell them, I'll see you after few days, I'll see you after few days. You'll have to repeat it. Stick routines when possible, and then give ample period of time and avoid rushing. Have patience when you are dealing with them. Ask them, give them time, ask in a very firm and split the words and be very firm in your words. Be slow when you read your sentences, when you ask questions. Allow them to process. This is something very important. And then the last slide would be, ask questions, understand them, talk about it. Whatever process you're dealing with, or if if you're a pediatrician, you tell them that this is it, I'm just going to give you medicines, you'll have to eat medicines, that's it. If you are dealing with the teeth, you just tell them, I'm just using your teeth, your mouth for some time, and then you, that's it, nothing else. So you have to talk to them when you're doing something. It's not that they can't understand. No, they can understand. You have to talk to them. Whatever you're doing, like a story, it will be suiting them. Include them in all your procedures. Come on, let's do this. You have to be like, you shouldn't think what the other person may think when you're doing it. No, you should be like a mad person, or you should get involved in their own world. That is how I included myself in my son's life. That I started understanding him, and I started imitating him. That was something which included me. Others around were thinking I've gone mad, I've gone crazy. It was like okay for me, because that is what I wanted to understand from his point of view, how it feels. So it works when you include. The word include is very common, but it's missing somewhere. Show your support. Yes, you need to tell them, yes, I can understand you, relax. You're feeling sad, it's okay, relax, I can understand you. You need to affirm them or give them that validation. Yes, I'm here to support you, I can understand you. And the word relax plays very important role. You need to tell them, even if you know that the child is not understanding or whatever you are judging it. The word relax plays very important role in special needs. Make a difference, and that is my opinion or my suggestion, advice, whatever you feel I'm giving it to you, is you have it in you to make a difference. So please make that one step of difference in special needs while you are treating them. So this is all from me. Going ahead to Dr. Ghazala.
Thank you so much, Aisha. Thank you. Thank you for your lovely session and all the lovely strategies that we can use. um, I think as dentists, I think a lot of dentists have logged in. Um, what I feel I picked up from this session was one specific thing called visual schedules or visual charts that I think we
Yes.
dentists don't keep it
Aids,
at
yeah.
home. So I think we should start having these visual charts and visual schedules so that when the child walks in, we are able to walk through the child as to this is what we are going to do. And the second thing that I loved was the emotional thermometer. I think even that needs to be there in our clinics, where we can show this chart, or probably on a wall we can have it painted, and we can ask the child how the child is feeling. One point that I'd like to add near the behavior reinforcement was the punishment strategy. That should be the last resort that we opt for in a child who is a special needs child. As Aisha very rightly mentioned, that the first thing that we need to do with a child with a special needs is to uh, create the rapport, build up a communication style. Don't jump into procedures. And the first appointment, let it be where you're communicating with the child, understanding the child better, and let the child understand you, get familiarized with you. And only if you're not able to use the other strategies and nothing is working, then I think punishment works. Yeah. I have with me.
Punishment should not be used. Actually, punishment should not be used with special needs,
Yes,
nor with the common kids.
general
Punishment is
kids.
a very negative thing which we have gone through so far.
Yes,
But this
that
generation,
should be the last.
you won't be, if you are doing a negative punishment thing, that will reverse in other psychological ways.
Yes,
That
yes.
is
We
something
have many other
which I
strategies
would
that we
also
can.
mention that,
Yes,
yeah,
yes.
it will have negative impact on the child. Even in common terms, negative punishment is the last or the least, or which you can't do or die kind of
Yes,
situation.
yes.
Then it
There's
works.
always a better way to handle things rather than punishing and beating a child or any other kind of physical, abuse. Now we also have with us Rini Tony, and I think she is also a very good friend of mine, and she has been a special educator, I think, for over a decade. Rini, are you online? Is there anything that you
Yes,
would want
yes,
to
very much here. Yes,
add on?
yes, yes.
I have
I'm here.
seen her handle kids, from over a decade. I think. How long have you been with kids, special needs kids?
More than 20 years.
More than 20 years, mashallah, mashallah. And I have seen how beautifully she blends with them. She psychologically counsels them, teaches them, plays with them. So, is there anything that you want to add on from your side?
Actually telling, seriously, I was like so happy to hear from a parent. The first thing what you said, what touched me, and see, you made that first statement, no, that no, you should understand that there is no recovery for this. As a parent, when you say that, it's very meaningful, very strong. I'm not a parent, nor do I have a child with it, but you coming that is very, very strong. I was literally in tears when you made that statement, because there are so many parents who come to me and ask this question. See, I cannot, even if I have 100 years of experience, I can't make that answer for it. But when you said it, it was so, so lovely that, I love the way you boldly said it. It is so good. That that's actually true. And every bit of what you were saying, I was just going through. It was like a memory refreshing for me, because visual schedule is something I passed out from Spastic Society of Karnataka. So we insist a lot on visual schedule. So that, I was just so happy that yes, that is what we need. In fact, I would seriously tell you, all the parents, all the therapists out here, that it's important to have the visual schedule, and it does wonders in the child's life. In fact, it is like a reminder for me also. Yes, you need to get new visual schedules, do new things with it.
True.
It was quite beautiful, and the session was really amazing. I was so happy. I was actually planning to message Ghazala asking for your number.
That's the reason, because I've seen Aisha grow as a parent and then as an
Yes.
educator, and then how she got involved into becoming a mentor and an educator for
Yeah.
children. That's a lovely journey.
Yes.
Probably she was
True.
not able to
Very true.
describe the entire journey in this presentation, but I have seen her grow through it, and that's the reason I wanted her to speak, because as she's a parent of an autistic child and an educator,
Exactly.
so she will
I
have better
understand.
insights to
It
give.
makes a big difference. Like
Yes,
Ghazala said, a therapist speaking.
yes,
No, as a therapist, I'm telling you, when a parent speak, it's like so much positive for all the parents
parents
out
out
there.
there.
Trust me, and I will not have a problem saying that, because it's really, really nice as a parent when you tell out there. It's like reinforcing all the parents out there, telling that see, we can all do it together. You know, it's really, really nice. I really
Thank you
enjoyed
so
your
much for
session.
giving
Thank
me
you,
this, having an
thank you.
experienced person and telling me this was, uh, yes, this is an, positive reinforcement for me. Thank you, Dr. Kazala, for
Thank
giving me
you,
this
No,
thank
positive
you,
because
reinforcement.
see,
thank
I couldn't believe